Liposuction is a very interesting subject. Liposuction is not a license to eat. When you do liposuction, one of the key things is that it does not change your numbers. The things, if you lose weight in a proper manner, your cholesterol will go down, your heart will get better. If you have heart disease, your blood pressure will go down. Liposuction does not do that. Liposuction is not about health. Liposuction is about pretty. Now, when you do little bits of liposuction, which is a trend now, when you gain weight, or if your weight fluctuates, you're going to get divots or ripples. You have to do it in single planes. So if you do a stomach, you have to do the whole stomach, unless you are a model or a real athlete and you're just perfect and you're taking a spot out, which is not most people who are seeking liposuction. But if you want to have real change, you have to have a commitment to diet. It has to be done in a whole surface, and it has to be done very evenly with tiny cannulas. When you use ultrasound or other heat sources, there is a whole issue of what that energy will do to the cells, and it's really not necessary. It makes it easier for the surgeon, but you don't really care about the surgeon, you care about you. When you liposuction an abdomen, you want to have a pinpoint in the belly button, you want to have a pinpoint in the pubes, and that's it. You don't want to have any marks. If you're going to have a million incisions in different places because it was done under local and with infusions, you're not going to get the same result. I like to do liposuction under general anesthesia because you can control the bleeding and you can do things that you couldn't do to somebody who was awake, and you can bend the patient a little bit and just do it just right. And you can use very long cannulas that bend, which would not be physically comfortable under local anesthesia. There's another aspect of local, which is how much local can you give somebody and what are the consequences. When you have surgery, the idea is to get it done right the first time, not to do a little bit and then come back and do a little bit and come back and do a little bit. And you need to see what you're actually doing. I feel that the best way to do it is with a 1.5 millimeter, 2 millimeter cannula, 2.5 millimeter cannula, perhaps at the largest, and take your time and really just get the fat out and do it in a very thorough and even way. My experience with spot lipo, of course I say it to see them, since I don't like to do it except on people who are very near perfect and just need a spot. But if you do spot lipo on somebody who's heavy, you have the issue of when they gain or lose weight and you have divots and you have an unevenness and a ripply quality, which is not desirable in the long haul. I feel that if you remove fat, you have to remove it in large planes so that it's very, very smooth. If you paint a red car or a silver car, you would really paint large areas, because if you spot it in, you can see the spots. And this is very much the case with liposuction in my experience, because the people who seek to be redone have had just spots done. You cover a lot of material, and it's pretty when you do it, but the thing is, these people are going to eat, and they're going to diet and exercise, and the fat doesn't respond evenly. The fat comes back in different ways, and areas that haven't been treated sometimes gain weight disproportionately to the areas that have been treated, and the effect of either ripples or divots occurs. I don't use constricting garments because we're just very careful to get all the fat off, and we have a very special way of doing it. My feeling is that when you use binders, you're doing a fat transplant, because there is a pool of fat in the area where you've done your liposuction, where the cells will live, and by putting on a binding garment, you're squeezing them in one direction or another, and there's a chance of a high spot appearing somewhere. But again, this is personal preference. This is not what everybody does. When you look at somebody who's overweight, you have to look at their cholesterol and their blood pressure and their blood sugar. Insulin is the fat storage hormone. The way to control that is by limiting sugar intake, and by thinking of what you eat is how it affects your insulin, because if you eat something sugary, your insulin will go up, and guess what? You're going to store fat. When you do liposuction, you really do not deal with the insulin sensitivity of the person. You do not change their cholesterol or other numbers. Only diet and good eating helps that. When you have liposuction, and you do a very thorough job, it can take a number of years, perhaps 8 or 10 years, to spoil the work. Uh, and it's never really as bad as you started. But the thing is that that is not really the way to approach it. When you have accomplished some dietary control, when you have some approach to your actual weight that you intend to be at, and then have residual fat, that's when you seek liposuction. And it has to be done very evenly and smoothly in areas. So if you just did an upper abdomen and you didn't correct your diet, your lower abdomen would come back and have the same amount of volume of fat, but in a different place. If you did the whole front, it would come back on the back. So you need to have complete dietary control, and you need to do large planes. You need to do the whole front, you need to do the whole back, you might have to do the whole thing circumferentially to get a permanent result or a near permanent result that's going to affect how you really look. And this is only successful when combined with diet, with exercise, and good common sense. Liposuction is not magic. It's not a license to eat.